So now for a common man to understand uh, exactly he is suffering from this particular Parkinson disease. So what are the key factors, or maybe how do I identify as a person that okay, this I am suffering from this?
Basically, is that it all presents with first is involuntary movements only. Although patient may have some memory decline or cognitive decline, so people don't understand that we are getting a cognitive decline or I'm forgetting things. But usually it presents with involuntary movements, and that is when they go to the doctor to help for the help, and then he is referred to a neurologist to get it worked up. And then subsequently there are certain investigations to be done like functional MRIs and PET scans. Then we come to a conclusion that this patient has got Parkinson's disease.
Okay. And is there any symptom which a person can voluntarily know about? How different it is than anxiety symptoms and the Parkinson symptoms?
Yeah, see, the anxiety will have very fine tremors. Anything, if he goes to work, that time he will have tremors. But Parkinson's these tremors are very big tremors, number one. Number two, they are not in voluntary control.
Okay.
Fine tremors because of anxiety, patient can understand that I can stop it also. These involuntary tremors which are in Parkinson's are actually not under the control of the patient.
Okay.
Because his brain is not producing sufficient dopamine. And when there is less of dopamine, the regulation of the whole process means everything has to be coordinated. See, if I lift my hand up, it is coordinated by my brain. All the movements are coordinated by the brain.
Right.
And when that coordination is gone because of the less of dopamine, that is where it's Parkinson's.
Right. So then what are the common misconceptions about this Parkinson disease?
Yeah, as I said, it usually presents with only involuntary movement. But that is just one part. Involuntary movement is a symptom where patient goes to the doctor for attention that, see, I have got this thing. But then in the background, there is cognitive decline, there is memory decline, then there are urinary incontinence, there are sexual problems. These usually patients don't tell us.
Right.
So these things are there, which happens. So these things are there. Then people think that one misconception is that the medicine does not work after some time. It's not so. Medicine keeps working after some also. But what happens is there are off phase and on phase. Sometimes patient is having full-fledged symptoms of Parkinson. Sometimes he might be absolutely normal.
Right.
So these off phase and on phases. So what patients think that I've become all right. It doesn't go. Parkinsonism is there, but it has on phase and off phase.
Okay.
So there are certain misconceptions about, and then basically people don't understand that cognitive functions and memory and other non-motor things related to movement, other than those, these are also as important. In even psychiatric, they have anxiety, they might have depression. And that was because of dopamine. Because see, dopamine is a chemical which gives you a feeling of goodness, that you have completed your task, you completed. Like people nowadays play games on the mobile.
Right.
What happens is once you achieve a certain level, your dopamine goes up.
Right.
So it's a reward chemical. So that also goes down because then you don't feel good working. You don't feel that you have completed some good task. Facial expression changes. Your handwriting changes. You write a check, you sign a check, and that bank sends it back that this is not the right signature.
Okay.
So these things are also important. Most of the people come with this, they are not able to sign.